here I am back again with the Sunset Family Health Team in Kenora, and that's, in case you're wondering, it's all situated in the Patterson Clinic. And right now with me I have Carolyn Hamlyn. She's a diabetic nurse education.
Yeah.
Okay. See, I'm really glad I'm doing this show because I'm learning so much about titles and who's in what and what's going on in Kenora with a health team. So the first thing I'm going to ask you is this came up at one of my last interviews and I wasn't too clear on it. So I'm just wondering if you can help me a little bit before I go on to actually what you do. And that is, I found out that there's a Northern Hearing Clinic here we're in downtown Kenora. So can you tell, can people just phone and say, can I make an appointment? Like, is it in the phone book? I've never even heard of it. I didn't, because I asked Barbara Pernsky, does this Sunset Family Health Team have a hearing thing? And she said, no, but there is so we ran out of time. So I'm going to ask if you can tell me a bit about it. And I did, before that even, I want to mention too, that I want to thank the Shaw, Shaw changed its name, by the way, so I'm a little confused here. What is the name, Vicki?
Spotlight.
Spotlight. It's the Shaw Spotlight. It's no longer Shaw Cable. Spotlight. I lost the piece of paper where I had that on with Barbara. Okay, well, it won't. Everybody will know that Ruth Bowick's not as smart as she thinks she is. Okay, so now we'll go on to this Northern Hearing. She's got ink here, but doesn't she mean clinic?
I think it is a clinic,
okay.
Yeah. So they're right on, you can go right on Main Street next to where Lowry's is.
Oh, yeah, okay.
So if you move down, there's a sign there, and I think if you go in, I'm not sure if it's upstairs or downstairs, but it's in that building, right on Main Street. I know that people can have hearing tests in there.
Okay.
They can help recommend hearing aids for you, and they can test your current hearing aids, do cleanings of them. A lot of people think that their hearing aids are starting to die, but actually it's because of the wax buildup in them. So they need to be cleaned once in a while. So they are very open to calling to find out. I do not think you need a referral to go there, but it might be helpful to find out for sure. But they are local here, and there's somebody there Monday to Friday manning the desk.
Well, I'm going to be doing quite a few segments for this Sunset Family Health Team here. Right. So what I'm going to do before I have my next one is I'm going to phone them. I have their number, and I will give it on before we're finished here. But I will phone them myself to see if you need to have a referral, so that when I come on with the next person, I'll be able to answer that. Because I think that's really important. Can they also take wax out of your ears?
No, but we can do that here.
Oh, you can do that.
Yes, we can do that here.
Okay.
We've got some nurses that can do that. We have some special equipment for that.
Oh, right. Okay. So that's something to know too. So now let's get on to your vital subjects. I'm going to go on to this referral thing. Right. Now, to get you, can we just call, how do we get in touch with you? We call you.
So with the diabetes program, if you have diabetes, or even if you have concerns about somebody in your family with diabetes, you can just call the Sunset Country Family Health Team at 468-6321 and ask to either speak to us or leave a message for us in the diabetes services, and we can help guide you on what you need to do. But if you want to come and see us, you don't need a referral for it, and you actually don't need to be rostered to a doctor.
Oh, okay.
So that's one of the things that's a little bit different with our program than any of the others, is that you don't need a doctor. Hopefully that will be remedied, and hopefully everybody will have a doctor soon, or a nurse practitioner. But for now, we will take on anybody.
Oh, good.
Yeah.
That's something for them to know.
Yeah, so they can just call. If you have a family physician, though, and you would like to come and see us, the physician can actually send us a referral, which is great, because sometimes they send a little bit more information to us that we can.
You could some of their medical history. Yes.
Yeah, we can do a little bit of homework before you come in, and that makes for a better appointment for the patient.
That's right too. Yes.
Yeah.
So, and you're in this building too. Everybody I'm interviewing is in this building. That's so nice. It makes it so nice and cozy. You don't have to.
It's a wonderful team.
You don't have to look around for a parking space. There's all kinds here.
Exactly. And the key to a team is sometimes people come in for diabetes, but there could be something else that comes up. Maybe somebody has a problem with their foot, so I can walk down the hall and talk to the chiropodist. So that's important.
Really?
Somebody might have a social concern. Maybe there's financial concerns or stress. I can go across and talk to our social worker who can help navigate the system for people. So from one visit, we can actually get, 3-4 other people involved in your care instead of sending you to a different place. So that's really great about being in a team. You can instantly. We do a lot of hallway, just talking amongst ourselves for the patient.
Okay. I've never really been around to see what's all here. Like I've just been to the nurse practitioner and to Mrs. Dearborn. And,
Yeah, so we have, if we go around the corner, we have a chiropodist, and we also have a foot care nurse.
Oh, I didn't know that.
Yeah, we have, there's 4 RNs working here in various programs, plus myself in the diabetes. We have a pharmacist, we have 2 dietitians, one that specializes specifically in diabetes, and in our bariatric group, we have an occupational therapist. So she's going to be involved in falls prevention. So she'll be coming to some of the seniors' homes and probably with us to the New Horizons to give a talk. I haven't actually talked to Britton about it, so surprise.
Well, it's a surprise to me because I'm the president of the New Horizons. So
it's just, we've just been talking. So
I'm finding out something that,
yeah, and she's a new position. So she's just in her first year with us, but she's really being a part of falls prevention.
There's a lot of, I shouldn't know if I'm using the wrong term, exciting things here with health, but there really is. I didn't realize there was so much going on in this building alone.
It is exciting, and we've expanded over the last year, so now we have the nurse practitioner clinic downstairs too. So it really is a team approach, and I think it's going to give better care for the people. And we work hand in hand with the doctors also.
Yeah, because they're just down the hall.
They are, and we're part of their team. It's all,
one,
we work together, and I think it's going to make for better outcomes. Keep people in their homes longer.
Right. Now, is there anything in that pamphlet you want to discuss before I move on to the next thing?
So talking about, we talked about being referred here to the family health team, and we also referred to getting a doctor. So if you don't currently have a doctor, or your doctor has retired, you can be, it's called rostered. So in order to get services, you have to be rostered to a doctor or a nurse practitioner. But the only way you can do that is to register on Healthcare Connect. So for people that like to use the internet, there is Healthcare Connect line you can go on to. And if you can call the family health team, we can give you this number, or you can just call. There's a 1-800 number. It's 1-800-445-1822, and again, we can make this available to have out there. You need to call and talk to the coordinators on that line, and they will register you on this Healthcare Connect. This is a ministry mandated thing, so everybody has to be, who doesn't have a doctor, has to be registered on this before a doctor can pick you up. It's part of the rules. So this is really important, this Healthcare Connect. If you want a doctor, or you want to get in on our nurse practitioner clinic, you have to register with Healthcare Connect.
Is there any charge for that, or is that all covered by OHIP?
It's all covered by OHIP.
Okay.
So basically, they'll ask you a few questions, what your birth date is. I don't think they ask for your health card number, but that might be a handy thing to have out, just in case they ask. And they will ask you if you've got any conditions. So sometimes, if you are perfectly healthy and don't have anything, that's great. But if you come in and you've had a history of heart disease or diabetes, maybe on insulin, it can sometimes push you to the top of the list a bit. So if you really, really need a doctor for this is what you want to do, but you have to talk to the people at Healthcare Connect.
Well, I think we'll have that phone number put on when Shaw Spotlight produces a show, and when we get to your set, and we can even put it on now and again as we're running through it, because there'll be about 10 segments of this. So we can, besides listing the healthcare phone number, we can also list some numbers like this. So so let's move on then to the actual, the annual, like things seniors. This is basically a program for, mind you, everybody's going to be interested in this health show that we're putting on, or I should say Shaw Spotlight's putting on. But we're trying to gear it for people 55 and over so that seniors know that they must continue to look after their health. So I'm just thinking in particular, like eye exams. What about like examining your feet?
Right. So in diabetes, especially.
Oh,
so
is that
is,
when? Oh,
yeah. So this is really about diabetes. So when somebody has diabetes, what it is actually a vascular disease. So what does the high sugars, or the sugars that are a little bit above normal, what do they do to our vessels? So it's really important for people with diabetes to get an eye exam every 1 to 2 years. So it's not the same as getting an eye exam for your glasses. They will actually put drops in your eyes, and the optometrist looks at the back of your eyes. So it's a special exam. In Ontario, people are, it's free of charge every 1 year. They can get that done at the optometrist. So you just have to, seniors. So actually, I think even people with diabetes, but seniors for sure can do that. So you just call and tell them you need a diabetes eye exam, and they will know what to do. The key with that eye exam, though, that I like to point out to people is you really shouldn't drive for a couple hours after, because they open up your pupils, and it kind of skews how you
It's
taking
like
the
coming out
light.
of the eye van when you go to the
It is,
when
yeah.
you get-
Things are just a
yeah.
bit wonky. So I like to tell people don't drive there. Get somebody to drive you there. But you should have that, excuse me, done every 1 to 2 years, because if they are seeing changes at the very back of the eye, it's treatable early on.
Good, catching it early.
It is. So we have a much more vast knowledge than we did 20 years ago. 20 years ago, I don't know if there's as much that could be done. But now,
You're talking about 20 years with the eyes?
with the
Okay.
eyes, if there were changes, now we have, they can do injections in the eyes, they can do laser treatments to preserve your eyesight, because you really don't want to get retinopathy, which is basically a destruction of the vessels at the back of the eye where actually our vision is. So really important to get them to look, because we don't know. People can have retinopathy starting and no visual changes. So we can't count on how we see things. We need the optometrist to look to tell how things are looking at the back of our eyes. So that's really
once a
important.
year they should be.
Once a year with a diabetic. So that's one thing about coming to see us, is that we keep track of that to make sure
They go,
people are going. Every time you come for a visit, we ask, have you had your eyes checked? And do a bit of a reminder for that. The other thing that's really important are the feet.
Yes, I'm surprised.
I know we don't often think about our feet,
No.
but when you have diabetes, it's very important, because again, it's our vessels that can be affected. So maybe the blood flow down to our feet isn't as great as it once was.
Was that right? That happens?
It can be as we get older, if we get a little bit swell. Anybody, actually, we really don't know. The other thing that can happen is when people's blood sugar goes up, it can affect our nerves that go down to the feet.
Really?
So maybe you don't feel things as well, and you could get a cut on your foot. And if you don't know that cut is there, bacteria can double every 20 minutes.
Real?
Yeah, and if you don't know that's there, and nobody has ever taught you to check your feet once a day, that can get out of hand pretty well, like pretty quickly, and turn into an ulcer that can turn into a really bad
Was that where you hear where some
infection.
people have to have their feet cut off or something?
Yes.
And toes? Oh my goodness.
Yes.
All because they neglected a scratch?
Yeah, so we don't always think of a scratch meaning much, but if we can prevent the scratches or prevent the scratches from getting infected,
That's what I was going to say.
we can stop the ulcers, we can stop the amputation. So that's a really big push right now, especially in the Northwest, because we have the highest rate of amputations in the province.
Do we?
We have
In the whole province of Ontario?
In the whole province, because we have a big area, and we need to do a little bit more work on that to get people, and it comes to simply checking your feet, good foot care, knowing what to do if you do have a problem.
You could be having me look at my feet every night.
You know, but you know, really for all of us,
Especially
it is.
in the summer when I'm tempted to run outside with bare feet for a minute to run to the garbage or something, you know, without slipping on my shoe.
Well, sometimes we can have a little crack because we have a dry heel and we don't even know, and all of a sudden that crack opens up just enough so now
that the bacteria
can get in. So we need to always, you know, teach people on how to look after their feet. And every time you come in for a visit, we ask, have you had any changes in your feet?
Oh,
once
you
a
do?
year. Yeah, and once a year for sure. I actually get people to take off their shoes.
Oh, my.
And I physically look at their feet. If we
I
see
hope they wash their feet before they come.
well, you know what? I think it's the point. I don't even notice anymore.
that right?
So don't
Oh,
even
don't
worry
go
about it
there.
when you come
Don't go
in.
there.
It doesn't even bother me anymore.
Well, I'm kind of glad I brought it up so that people are going to see you wash your feet.
Yes. Well, we're kind of a bit of the gatekeepers too, because if we see there's a problem, we can refer on to the chiropodist, so the foot doctor here.
Oh, right, of
So-
course. There is
so-
I didn't know. I forgot until Barbara told me there's a foot
so
doctor
she
here.
will do high risk, and if we have problems, so we can really nip things in the bud early. So it's really important, the feet, because we don't want people to end up in the hospital. We do find that if people end up with a foot amputation, especially the elderly, like over 80, they really just don't bounce back as quickly. So we don't want that. Just like falls risk, we want to keep people's feet healthy. So it's really important. And that's, again, something you come to see us, we review. So after a while, you just get it. It just becomes habit to check your feet once a day. That's all it comes down to. But something as simple as that, sometimes that was just never taught. Right? Oh,
Well, here we go.
we didn't pay our budget. Here we go. Or you've got to do a little flap there.
Oh, really?
No, we're
Are
on
you
these,
getting all this?
we're on motion detectors, so we all need to do just flap.
Can I? Here, let me. Oh, boy.
They're supposed to be. Isn't that
What am I
funny?
supposed to do? Just swing?
Well, yeah, they're supposed to just.
Oh,
there we
there,
go.
okay. See, I'm good. Listen, Vicki, I'm good for something. As soon as I stood up, the lights came on. I'm in the light.
Yeah, they're just. I guess if we're not in the rooms, it helps save some electricity for the town.
Oh, maybe. Is that you think that's what it is?
Oh, I think so.
Oh,
It's to
okay.
keep us on our toes.
Yeah, on your speaking of feet. Yeah, speaking of feet. Yeah,
So
no
that's
pun
really
intended.
important.
Yeah.
So we hold people, and if you can't get in to see us, just remember, take a look at your feet.
Okay.
Every day. Every day. If you have a bath or shower, you have to dry them anyways.
Yeah, that's right.
Take a look at them, right?
Especially dry
You
between
get up
your
in the
toes.
morning, just take a peek at your feet. See what's going on.
Great
That's
advice.
all it
I'm sure
is.
people are going to be listening to the Shaw Spotlight. They're going to think, my God, I never even thought of my feet. Because that's the first thing I said. Never even thought of my feet.
Yeah, a lot of people don't.
So does that to work into the blood work too then? Or is that something, a separate thing you'd like to talk about?
Well, the blood work is another thing that we can look after at the Family Health Team through the diabetes program. So we can look after some diabetes blood work because there are specific things that should be checked for diabetes once a year. We're very diligent about making sure your kidneys are okay because that's another thing.
Does that have to do with the blood work, kidneys?
It does.
Does it?
Yeah. So there's a few that we can draw on blood work that will tell us how well your kidneys are working.
Really?
And the kidneys are really important because we've talked about seniors being on a lot of medications, but a lot of medications aren't safe if your kidneys aren't functioning really well. So we need to make sure that your kidneys are safe. Number one, that the diabetes hasn't caused any problems because diabetes is pretty close to the number one reason besides uncontrolled hypertension for kidney problems in people.
So name a couple of kidney problems.
Well, basic chronic kidney disease. So what we will see is the kidneys themselves, they just start not filtering out the garbage in your blood as well as they used to. And they really are. They're important about keeping our blood pressure nice and stable and getting rid of all the garbage. So we have some very sensitive filters. And if they're not looked after properly, those filters start to stretch and not work.
Filters.
The kidney filters.
Okay.
And we can tell when there's been damage in the kidneys just from blood work.
Really?
Yeah,
Blood can tell you all that.
Yeah, blood can tell us a lot. The other thing we look at is sometimes we'll check people's cholesterol because there is a little bit of a correlation between higher cholesterol, high blood pressure, and diabetes. They kind of go together.
Or like a triangle.
Yeah, it's like a triangle. I call it the Bermuda Triangle. So we don't want three of those to be high. We don't want you to have high blood sugar, high cholesterol, and high blood pressure. That increases your chance of a heart attack or stroke exponentially. So we want to make sure we get all three of those to a treatable
My gosh,
level.
you're a wealth of information on this,
Oh my goodness.
Carol.
So we need people to come in because we know what blood work you need. Again, we work closely with your doctor. We talk about what we think. We always discuss the cases, and just to keep people safe, right? We want people to be safe. We want to keep them out of the hospital, and there's a lot of things that we can check to do that.
Very well. Now I'm getting to something that's kind of dear to my heart because I've seen it in my job when I used to do the Beeline and interviewing people that were 80 and 90 for their birthdays. De-prescribing. Please go into that in depth because if I just might give you a little hint that I used to go to a lot of older people's homes, men and women, when there was 80th birthday and the premier would be presenting them with the plaque or their 90th birthday or whatever. And to interview them to get a background on some of them were immigrants,
Right.
And I'd sit beside them just like this, and here'd be their little TV table loaded with prescription bottles, and I'd say, "Oh my goodness, like Mrs. So-and-so, like you take all of those, do you take them every day?" "Oh yeah," and she'd pick them up. "Well, I take this for my heart." She says, "I don't even know, I can't remember when I'm supposed to take this." And I saw that a lot, and that scared me.
Yes.
So
absolutely.
can you go into that a little bit about,
I can.
is there some time people can go to those people's homes and go through them and throw a lot of them back to the pharmacies for disposal, properly disposed?
It is a good thing to get rid of the medications that you're not using anymore, just in case there's ever any confusion or things like that, or you're getting up in the night, you're not sure what you're taking. You don't want to be taking the wrong thing for sure. But de-prescribing is a movement, especially with our older population, is what we're noticing is that seniors are on a lot of medication. And a lot of that medication, some of it can have cross things. So you take this because this does one thing to you, but some of them actually don't get along very well.
That's scary, isn't it?
It can be scary, absolutely. And there's some medications that we have to look at, like we said, with kidney functions or have liver functions been drawn, which are both blood work that we can tell. And in the diabetes world, there are some we kind of put as higher risk medication that can give people lows. So we don't want people to have low blood or blood sugars because it makes you feel terrible. It can make you feel dizzy. You could have a fall alcohol. It's just dangerous.
That's low blood sugar.
That's
as
low
opposed
blood
to
sugar.
high.
That's right, because some of it just doesn't get processed the same way as it did when you were 40.
Okay.
So we would want somebody to be on maybe a different medication than that. So that comes with people whenever they come into the doctor's office or they come to see us at the family health team, we want you to bring your bag of medication. Everything you've got, whether it be an herbal supplement, whether it be a vitamin, and plus all the prescribed medication, so that we can go on and absolutely make sure that your medical records are up to date. If we see some flags that we think, wow, you're on a lot of medication, I'm not too sure about this, we'll set up an appointment with our pharmacist who will actually go over and do a medication review.
Well, that's wonderful.
And then call you in and go over this.
And it's nice the pharmacist is right here too.
She's right here. She's part of our team, and that's part of her role. So there's always certain medications that we're looking at, and we're trying to get people off medication. Like
that's a good idea.
As much as you safely can. People need medications, they're good. But what we're questioning now, do we really need as much as what people are on?
Sometimes it's
overkill. We've had people that have come through our memory clinic, which is another thing that we have here.
Oh, really?
With
you, with the
family health team. So that's a referral.
A memory clinic.
A memory clinic. So that's a referral from the doctor. It's a big thing. You're here for about 3 or 4 hours.
Oh, really?
Yeah, you meet with a team.
One-on-one?
Yeah,
or a team.
Yeah, you meet one-on-one with a nurse. We do some memory testing. Family members come in, and we've got members of our team that talk to family members, because there's always two sides of the story.
Is this separate from Alzheimer's? This memory, or is this?
Well, the Alzheimer's Society actually works with us in it. They're part of our team too, so they come in, and we just kind of see where people fall in the spectrum. Is it just normal cognitive aging?
Divisions, like a big division, fall into a category really highly with memory or slipping?
Well, we've got a lot of people that just are kind of in that mild dementia. So there is some cognitive decline. And what we find when people start getting into certain things, there's a certain percentage that will stay, and there's certain percentage that will go on into the dementia realm. But what we have found, going back to the medications, is we've been able to deprescribe certain medications that people have been on or decrease the dose. And people's actually cognition has come back quite well.
Oh, so, really? Isn't that wonderful?
Not with everybody,
no,
but that is something that we look at too. And that's where deprescribing really shines, is that we look at, is there anything that could be affecting your life instead of benefiting it right now? Like anything that's more of a risk than a benefit, we need to either find a safer option, or maybe you don't need it anymore. Maybe you've just always been on it for 20 years and not really sure, because that doctor has since either moved away or they've retired or what. But we need to take a good look at your medications all the time. So you bring them in when you come so we can know that.
Okay, so if they bring this big bag, and I'm sure some of them would have a big bag from what I've seen personally.
Big bags.
Yeah. So can you actually right then and there tell that person, you don't need this anymore, and I'm going to see that it's disposed of? You're not taking it home.
What we would say to them is that we have concerns about this medication, and I would really like to talk to your doctor about it.
Oh,
and we're
that's
going to decide from that. Yeah, because we can't physically just pop it away unless it's something that it's actually not prescribed anymore. Like if they've been carrying it around, and let's say
some of them do. They don't like to part with it, I think.
I have some family members that I have found antibiotics.
Your own family members?
Yeah, that are 5 years old. So I've just pitched those ones. So that would be a safe one to say. But anything that's still prescribed right now, we probably wouldn't get away, but we would have a flag.
Okay.
Yeah.
Well, I'd like to ask you something else kind of personal too then. Okay. Would be when I want to tell or bring my bag. Well, I take two prescriptions.
Yes.
For macular degeneration.
Right.
And for high blood pressure.
Okay.
It's Ramipril. But I've also bought some calcium that I take off the shelf.
Right.
And I've also bought some zinc.
Right.
Okay. Now, so I bring those two too?
Absolutely, because some medications that you take over the counter, we don't want you to take with certain other medications. So somebody that would take an over-the-counter Rolade might decrease the chance of when you take your, say, blood pressure pill or something. So that would be something we would ask our pharmacist. Is it okay to take zinc at the same time that you're taking the Ramipril? So bring it all in. Everything you've got. Bring the whole cupboard. Because you think when you see the ads, unless you've used Rolaids, so I'm going to say the Rolaid ad, it seems like if you get the least up, so swallow a couple of Rolaids and you're going everything's going to be just fine. Good. I know. So bring it in. Everything you're on, bring it in.
Well, listen, Carol, and I want to I think I've got a couple of seconds here, but I just want to tell my audience there that's going to be watching this on Shaw Spotlight that Carol and I were neighbors on 4th Street North many, many years ago, and my daughter, my middle daughter, Beverly, actually babysat her, so that shows you how old I am. So I'm well qualified to talk about anything in the 80s and how about Medicaid. And she was a lovely child. She had one brother and a sister.
Yeah.
Yes, and I think actually Beverly babysat them all.
Yes.
Yeah.
And she survived us too.
And she's doing very well, by the way. Okay. Yeah, I just thought I'd mention that. So it was such a pleasure to see you here.
Thank you.
Because I mentioned the last time I had anything to do with you, it was not that I was up for what do you call that with the cancer?
chemotherapy.
The chemotherapy, but I had a friend that was, and I used to see you there and keep in touch.
Absolutely.
And then I hadn't seen you for a while, so when you walked in, it took me about a minute to realize, oh, this is like Carol Bush to me. Yeah, okay.
I'm everywhere.
Yeah, okay. Well, thank you so much
You're
for joining us,
welcome.
and I want to show a spotlight for producing this for the seniors in Kenora. And I will be back. I'm not finished here at the Patterson Clinic with the Sunset Family Health Team, so I will be back with some more interviews in about a week. Thank you very much. Thank you.